دكتورة Assistant Professor منى زكي. منى زكي. Role of Preoperative MRI and Surgical Planning. Professor منى Zaki is Assistant Professor of Radiology, Mansoura University.
Hi. Firstly, I'd like to thank Dr. Nuran Hussein for inviting me to give this lecture today. Thank you, Dr. Nuran. Today I will talk about accuracy and impact of doing preoperative MRI in surgical planning of breast cancer. Firstly, certain questions need to be cleared in this lecture. Does every case with breast cancer will have to do MRI if the patient is planned to do breast conservation? Is patient with invasive lobular carcinoma is like invasive ductal carcinoma? Is patient with invasive ductal carcinoma is like ductal carcinoma in situ? And last question is, do younger patient group will get benefit as old age group? MRI increasing used in the management of patients with breast cancer. One of its main indication is to delineate the actual extent of the disease, as it improves assessment of lumpectomy volume, reducing frequency of re-excision, re-operation, and reducing positive surgical margin. It also identifies multicentric disease, so it better identify patients who will be candidate for breast conservation. And lastly, it detects the occult contralateral breast cancer, decreasing the incidence of metachronous breast occurrence. One of these factors are considered to be good candidate for preoperative MRI to be done, which is young age group, dense breast, hormone receptor negative tumors, and breast conservation without radiation therapy. Also, there are certain types of tumors are considered very sensitive to MRI, which is invasive lobular carcinoma and ductal carcinoma in situ, whether it is pure ductal carcinoma in situ or associated with invasive components. As you can see here, in this case, preoperative MRI adds the information of there is multifocal affection, also there is multicentric affection. Also in this case, there was a very small group of grouped microcalcification, pathologically proved to be ductal carcinoma in situ, but when the patient did preoperative MRI, it delineated that there is a very large area of affection by in situ component. Also in this case, the patient was diagnosed to have invasive lobular carcinoma by measurement of 1 centimeter. After doing preoperative MRI, the invasive lobular carcinoma was over an area of 6 centimeters. And in this case also of invasive ductal carcinoma, MRI adds the information of presence of multifocal and multicentric disease. However, preoperative use of MRI in local staging of pathologically proved breast cancer is common but still controversial indication, as the detection of more disease of MRI has not been translated into improved outcome. So guidelines differ variably in the recommendation for doing preoperative MRI in patients diagnosed with breast cancer. Studies show that women undergoing MRI will have very high incidence of unneeded mastectomy. So incorporating MRI information to reduce re-excision rate is challenging. And these are different studies comparing re-excision rates in patients with breast cancer doing MRI preoperatively and not. Only 3 studies demonstrated significant reduction in re-excision rates when the patient do preoperative MRI. Only 3 cases. As I said, the majority of studies demonstrated that there is no significant reduction in reoperation and re-excision rates when do MRI preoperatively. But this study, which is called POMB study, it was done on young age group, demonstrated significant reduction in re-excision rates when doing MRI preoperatively. This trial, which is called COMS trial, demonstrated no significant reduction in re-excision rates when doing MRI preoperatively. Also, this study demonstrated that additional lesions was revealed by MRI led to unneeded mastectomies. And this study, which is systematic review and meta-analysis done this year, demonstrated that preoperative MRI leads to reduction of local recurrence rate, reduction of positive surgical margin. As detection of contralateral breast cancer, as in this case with locally advanced left breast cancer, MRI demonstrated additional contralateral breast cancer, small one, at the same time. Also in this case, with multicentric affection on the left side, there was small deeply seated lesion which was hardly seen by ultrasound. Contralateral breast cancers detected using MRI are usually small, 1/3 are DCIS. Detection of contralateral breast cancer is considered high-risk screening. However, also most studies didn't show reduction in metachronous breast cancer occurrence by using preoperative MRI. However, there is one study showed reduction in the occurrence of metachronous breast cancer when doing MRI preoperatively. And there is no evidence for improved disease-free survival and overall survival doing MRI preoperatively. However, this systematic review and meta-analysis done this year also concluded that there was better detection of contralateral breast cancer, decreasing both synchronous and metachronous breast cancer occurrence when do MRI preoperatively in pathologically proved breast cancer. And the following is special situations and areas of ongoing research considering do preoperative MRI. In these conditions and factors I mentioned before, that MRI preoperatively will be very useful in women with dense breast, cases of invasive lobular carcinoma, and cases with ductal carcinoma in situ. Considering dense breast, we all know that sonomammography has lower sensitivity in dense breasts, as we can see in this case. So the increasing use of preoperative MRI was documented in health claims. Excluded from this claim the young age group. And this study, a Swedish study called POMB study, designed for young age group and demonstrated that doing preoperative MRI lead to significant reduction in re-excision rate. However, all this study demonstrated no significant reduction in re-excision rate when doing MRI in dense breast and young age group. Considering invasive lobular carcinoma, as we know that it has high incidence of multifocality, multicentricity, and bilaterality, as in this case. There was one study done this year and concluded that high density of the mammogram together with pathologically proved invasive lobular carcinoma is considered a selection criteria to do preoperative MRI. However, another studies demonstrated that doing preoperative MRI in invasive lobular carcinoma patient didn't lead to better reduction of local recurrence of survival rates of the patients. Considering ductal carcinoma in situ, as we can see here, a very small group microcalcification and MRI demonstrating the actual extent of the disease, which is multicentric. Also, there was one study done on large group of patients having DCIS, demonstrated that doing preoperative MRI led to better re-excision rates and decreasing positive surgical margin of the patient. However, also another studies done on large group of patients with DCIS demonstrated that preoperative MRI didn't affect the surgical impact. Till now, there is ongoing research. It is specifically done to special biological types of the tumor, which is triple negative, ER negative, and HER2 positive tumors. And this trial, till now, it is powered to detect an improvement of local recurrence by 8%. And lastly, we want to conclude and state that preoperative MRI needs additional study in a well-designed prospective studies to define its actual value in treatment planning for early-stage breast cancer. And till now, data suggests that preoperative MRI will increase the need of unneeded mastectomies, additional biopsies, and can increase detecting ipsilateral and contralateral disease. Thank you.
Thank you. The next talk is